I gotta stay cool too, and no, I'm not a fool. I know eventually I'm gonna have to choose, and really I don't wanna lose my ticket into heaven and a chance to be used by you. But if it's God that I'm after, then I can't serve two masters. And before something happens, I gotta turn it all around, because I know I can't just have my cake and eat it too. Yeah. Because it's real easy to stay on the fence and still do it. It'd be cool if we could love the Lord and still go do our thing. See, it doesn't work like that. You gotta be white or black. Lord, I realize when it comes to sin, you just don't compromise. Yeah, it's a matter of death and life. Be weak and do wrong, or be strong and do right. And I don't wanna keep going to church, thinking about how much you're worth to me. Then continue doing my dirt, living as if I didn't care if you hurt. And if it's God that I'm after, then I gotta pick one master before something happens.
Good night, ladies and gentlemen, to the best place to be on a Thursday night. Once again, if the Prime Minister of Barbados does not have a press conference, this is the best place to be right here. TNT, we are coming to you live from the St. Thomas district of Seventh-day Adventists here in Barbados. And I am your host, as usual, Justin Aline. And tonight, we have a program with a difference. We are talking about adolescence and sexuality here in Barbados and among the youth. And tonight, we have some very special guests. And after our prayer, we're going to introduce those special guests to you. And I am going to leave the chair and let the number one fan of the St. Thomas District, especially for Thursday Night Talk, Dr. Marcia Cambridge Maxwell, take over for me for tonight. So you will not see this beardy-faced gentleman tonight much, but you will see the lovely Dr. Maxwell tonight, and she will take you into the next program. Now, before we get any further, let us bow our heads for a word of prayer. Heavenly Father, we give you thanks for allowing us the opportunity to be here another Thursday night. Even though we are preparing for a storm, we ask, oh Lord, that we would be safe and that the storm will go and it will do no damage to no country, even Barbados, no other country in this world. So we pray, Lord, that we be safe under your arms. And we pray, Lord, that you will guide tonight's discussion, tonight's talk, this important discussion about sexuality among adolescents here in Barbados. And we ask, oh Lord, that everything will be said and done to be done to your name's honor and glory. For these things we ask in Jesus Christ's name. Amen. Amen. Now, ladies and gentlemen, as you know, we are always sponsored by someone very special. And tonight, we are sponsored by Neeks Beauty. Now, this young lady, this very young lady here, Neeks Sewing Room, for all your back to church fabric, face masks, and all your special brooches. And you just need to contact Neek 249-3965, 249-3965, Neeks Sewing Room, and she will prepare that lovely mask for you, a mask, and also the lovely flower, the brooch, that will, make sure the ladies are all well decorated, all well, having their flowers and all those pretty stuff. You just check out Sister Nicola Yearwood at 249-3965, and also she make lovely uniforms, so you can ask Sister Nicola for your uniforms for back to school, all your back to school uniforms for Wilkie Common all those primary schools. You can get them done by Neeks Sewing Room, 249-3965, and also her home number is 420-2543. Also tonight, I just want to let you know that we have two lovely books for you, and one by Nancy Van Pelt, The Complete Tween. This is a very important book, very, very important book. I want to let all of our youth know that if Do you sometimes feel inferior? Are you afraid to talk to your parents about sex? Do you want straight answers about the facts of life? Do you want to know what makes you attractive to a girl or a boy? If your answers to all of these questions is yes, then you are a tween and you need to read this book. So this book at the ECC, at the East Caribbean Conference of Seventh-day Adventists, you can go right there and to get your book, you can call the publishing department 429-7234 and get the complete tween for just the wonderful price of $45 or $57.60 EC. And there's another book, and if you have, you're a parent and you have an adolescent and you just want to know why these little ones are giving us so much stress, you need to read this book to adolescents and parents. And if you are an adolescent and you realize that you are not understanding your parent or you don't understand the mature folks, this is the book for you. Just $60. Just call the East Caribbean Conference, the publishing department, 429-7234, and you can collect these books. These books are very important. So we recommend these books for you, and these are our sponsors for tonight. The East Caribbean Conference of Seventh-day Adventists, especially the publishing department, and also Nick's Sewing Room. So without further ado, I just want to introduce my lovely co-host tonight, Dr. Marcia Cambridge Maxwell, and she will do all of the introductions for you guys tonight. Over to you, Dr. Maxwell.
Thank you very much, Elder Justin Allen. Welcome everyone again to Thursday Night Talk. Indeed, we have 4 expert panelists for you tonight, and the information they have to share is priceless. So there's nowhere else to be. Call a friend, send a text. Make sure you tell everyone this is the place to be. Send them the link and let them join the chat right now. So I'll go into the introductions. I'll introduce our 4 panelists, and then we will hear from them individually before we start to take your questions. Remember, you can enter your questions into the chat as we go on, also on YouTube as well, and our producers will be feeding these questions to the panelists later in the program. Now, our first panelist is Pastor Miguel Denny. Pastor Miguel Denny currently serves the East Caribbean Conference of Seventh-day Adventists as Youth Ministries Director, having ecclesiastical responsibility for all Adventist youth on the islands of Barbados and Dominica. The task is his to consistently organize and implement programs to keep these youth meaningfully engaged as they develop mentally, physically, socially, and spiritually. He graduated with honors from the University of the Southern Caribbean in 2009 with a double degree in theology and biology, and served in pastoral ministry for 6 years in Dominica before becoming youth director in 2017. Though his reading for his master's in public health was halted because of the devastating effects of Hurricane Maria on his homeland in Dominica, Pastor Denny remains passionate about public health and will resume such studies in the near future. In 2019, he was asked to serve on a National Health and Wellness Task Force where different stakeholders seek to find creative ways of promoting health across Barbados, ensuring the island's youth are not ignored but are intentionally catered to in this regard. He sees it as a fine opportunity to share the Adventist health message to the citizens of Barbados. Pastor Miguel Denny. Our second panelist is Dr. Shanae Gill. Dr. Shanae Gill is an assistant professor of clinical medicine with the Ross University School of Medicine in Barbados. She received part of her medical training at the University of the West Indies in Trinidad and Tobago and returned to Barbados to complete her Bachelor of Medicine, Bachelor of Surgery. In 2013, she went on to obtain a diploma in sexual and reproductive health from the University of Liverpool, where she also received certification in adolescent health and obstetric services in low-income settings. She is currently enrolled in the Masters of Public Health program, specializing in health services management with the London School of Hygiene and Tropical Medicine. Dr. Gill has worked as a general medical practitioner in Barbados and has also worked with the Ministry of Health as a clinical medical officer in HIV medicine. In 2013, she began lecturing at the American University of Barbados School of Medicine, where she taught microbiology and immunology. In 2015, she became the medical director of the Barbados Family Planning Association, working closely with adolescent health and HIV STIs nationally. Most recently, she has worked as a consultant with the United States Agency for International Development, USAID, to develop community HIV testing sites for LGBTQ persons in Barbados. She is also a member of the recently created Barbados chapter of the International Women's Forum, which focuses on developing leadership skills for women and girls. In her free time, she actually has free time, Justin. In her free time, she enjoys creative writing and has been the recipient of National Literary Arts Awards in 2017 and 2018. Dr. Shanae Gill. Thirdly, we have Dr. Courtney Yarbrough. She is a board-certified obstetrician and gynecologist. She completed her medical training at the Tulane University School of Medicine in New Orleans, Louisiana, and then completed her internship and residency training at Baylor College of Medicine in Houston, Texas. She went on to complete a fellowship in pediatric and adolescent gynecology at the Hospital for Sick Children in Toronto, Ontario, Canada. Dr. Yarbrough is currently practicing as a general obstetrician and gynecologist in Barbados at JRB Medical Center in Belleville. At this location, she specializes in the care and evaluation of the specific gynecological needs of young girls, adolescents, and young women. In addition, she counsels adolescents, young women, and adult women on STI prevention, safe sex, and HPV vaccine. We will hear more about that. She also evaluates and manages early pregnancies and their complications, abnormal menses, dysmenorrhea, endometriosis, fibroids, and other gynecological conditions. She is dedicated to teaching young women about their gynecological needs and empowering them to make healthy lifestyle choices for their present and their future. Dr. Courtney Yarbrough. And our final panelist tonight is Delvina Waite. She is a senior child care officer at the Child Care Board Barbados, with current responsibilities for the monitoring and registration of all registered day nurseries in Barbados. She has a master's degree in education and a Bachelor of Science degree in social work. Previously, she coordinated the intake, child abuse, and residential care programs of the Barbados Child Care Board. Mrs. Waite is also an online facilitator in children and family studies and has years of experience in working with children and young adults. She also serves as the Children's Ministries Leader, Children's Division Leader, and Assistant Personal Ministries Leader at the Advent Avenue Seventh-day Adventist Church. She loves working for the Lord in touching lives of individuals, especially young people, and making a positive difference. This is Mrs. Delvina Waite. I want to say a very special welcome to all of our panelists. Welcome to Thursday Night Talk. And let me first say thank you for doing what you do. Now, we will start with Pastor Miguel Denny, our youth director. Pastor Denny, what is the church's position? What is the Bible's position on sexuality and sexual conduct in adolescent population? And is this position a practical one?
Thank you very much, Dr. Maxwell. Good evening, everyone. I seen that this is Thursday Night Talk, and we are a Seventh-day Adventist sponsored program. I can't help but be biased as being a Seventh-day Adventist to present our church's position, which is really the Bible's position. Clearly, we see from the Bible that marriage was a divinely instituted and established entity from Eden and affirmed by Jesus Christ to be both monogamous and heterosexual, implying a lifelong union of loving companionship between a man and a woman. In essence, any sexual relationship, any sexual intercourse from the Bible must take place between a married couple as in a male, female, husband, wife. That's the basis of our understanding primarily of sexuality and in terms of sexual intercourse between individuals. Hence, the notion of sexual activity or sexual intercourse amongst adolescents is frowned upon, is not considered morally upright or just. It's essentially a no-no. And to put it bluntly, that's just how it is. The Bible does not minced terms when it comes to any form of sexual intimacy outside of marriage, as well as any sexual aberration, even within or outside of marriage. So the Bible frowns upon sexual abuse of spouses, sexual abuse of children, and any other form of sexual activity that lies outside the range of a married couple. Hebrews 13 verse 5 says that marriage is honorable and the bed undefiled. Now, I'm sure many of you listening to this are probably thinking, Pastor, these things are very antiquated. That's Old Testament, New Testament talk, that's Bible talk. We live in a day when sex sells and sex is all around us. But the Bible, if we still believe that the Bible has place in the Christian's life, in the Bible believer's life, then it has to take reign in all aspects of our life, not just with sexual intercourse, but with every activity. Interestingly, the Bible is specific as to what is the youth. And by youth, we say anyone between the ages of what? Well, under the age of 18 or even above, or even unmarried persons. 1 Corinthians 6:18 tells us to flee fornication. The simple answer to teenage or adolescents' sexuality is to run from it. That's as plain and simple as it is. 1 Corinthians 7 verse 2 adds, nevertheless, to avoid fornication, let every man have his own wife, and let every woman have her own husband. I think later on in the chapter, in that same chapter, it says it's better to marry than to burn. And as you may say, well, Pastor, this is antiquated. This is Bible, Old Testament. But even in 2020, I do believe, and I do know of individuals who can safely say they are waiting until marriage to enjoy the bliss of sexual intimacy. I'll tell you something one of my colleagues would always say, sex isn't running away from anybody. It's not running, it's not looking to duck and hide and avoid you completely. When the time is right, you found that person that you can share that level of intimacy with, it'll be right there waiting for you. And so one typical example, a biblical example that we often reference in terms of how young people should view sex is Joseph, when he was faced with the temptation from Potiphar's wife. And we often think, well, if it was me, I would have done that. Joseph had everything to profit from. He had nothing to lose if he went along with Potiphar's wiles and advances. But I want us to consider something. If Joseph, seeing all the advantages of being intimate with Potiphar's wife, still chose the Bible way, still chose God's way, still chose to honor God outside of, or regardless of whatever worldly or mundane reward he would have gotten from Potiphar's wife. Why can't the average young person who may want to have sex for just the fun of it, who may be persuaded to do it because your partner is pressuring you, or there's a unseen or non-specific pressure that if you're at a certain age and you're not sexually active, there's something wrong with you. So many youth make these decisions for less reward than Joseph would have received. But yet Joseph decided for himself that him honoring God was more of greater import than simply receiving the pleasure for a season. So that's one. First of all, understanding that this is God's will, that you should not. 1 Thessalonians 4 verses 3-4 add that this is the will of God, even your sanctification, that you should abstain from fornication, that every one of you should know how to possess his vessel in sanctification and honor. So Paul calls us as well to some level of discipline. The same way that we would want to discipline our bodies to not eat certain foods because we want to get that summer body, or we want to lose some pounds, some COVID weight. A similar discipline we would use to study and to pass our exams because we want to attain that degree. And it might mean saying no to some of the parties, or saying no to staying up late, just talking or watching sports when you're taking the time and beating those books to get that information in. That kind of discipline can also be used in terms of keeping ourselves sexually. And Philippians 4:13, a key text, I can do all things through Christ which strengthens me. Any circumstance, God is willing to give us the strength. Now, let me conclude on this point, even though I've spoken a lot. The church's position on sexuality in general does not mean that if by chance you have made a mistake or fallen short of the ideal of the expectation, that you're not less of a person, that you're not of value, you're not of worth. Persons, especially our youth, end up in sexual encounters, sexual situations for different reasons. It could be abuse, it could be peer pressure, whatever the case is. You are not any less of an individual. You're not any less in the sight of God. God is willing to forgive, to restore, and to work with us no matter what state we are in. And I'm sure the information we're going to garner tonight is going to be of benefit to everyone. But as Seventh-day Adventists, this is our position. It is not to be forced upon anyone. We all believe in the freedom of choice, but as Christians, this is what we stand for, this is what we believe, this is what we endorse, we preach, we practice.
And Pastor Denny, is this a practical position for the church to have in 2020?
I'll tell you this much. Being again with my Christian bias, I have never seen God be wrong.
Oh.
And it pays if we trust God with everything else in our lives to, what it be to return a faithful offering or tithe, as some churches may or may not practice, to come to church and worship and fellowship with each other. If it pays to witness and tell us about the love of Jesus, I think it is also in good taste or in good merit to trust God's ideal plan for sexual intimacy, which is to wait until marriage. If we can say that lying is wrong, if we can say that coveting is wrong, if you can say that taking God's name in vain is wrong, honoring your parents is good to do, and all of these things, and God gives us the strength to accomplish or to be able to do these things, how much more is God willing to give us the strength and the ability to keep ourselves sexually pure? It is practical. I'm not saying it's easy, especially for how the world pushes sex right now. You don't have to do much. You look at some commercials and you see a naked lady or some bareback man posing and all kind of thing, and at the end they're talking about beer. It's like, what was all this for? And that's how the world is. You don't have to go far to find it. It's everywhere. But God is still saying that his grace is sufficient for us. And we can live pure lives, sexually pure lives, even in 2020. It is not impossible, and we can do it by God's grace.
Thank you very much, Pastor Denny. Dr. Shanae Gill. This is our specialist in adolescent health and obstetric emergencies in low-income settings, and I really took note of that. Do you think in Barbados, our young people are becoming sexually active and at an early age, and to what would you attribute this phenomenon?
Okay, good night, everyone. Just to add, and so as well, I did have. So yes, we do. It's an issue in terms of Barbados, not only Barbados, but the Caribbean in itself. And there has been plenty of research going into the reasons behind, again, early initiation or early sexual debut among Caribbean youth. And a number of factors then have been identified. So before I do, I just want to just briefly, if I can just share my screen briefly with you all. And right, just in terms of some statistics that we have here relating to adolescent sexual health. So I'm just really going to start off really, I'm not going to do too much, just really looking at the survey that was done, the 2017 profile with the Pan American Health Organization, or PAHO, looking at the trends in terms of Barbados. It found that the fertility rate among adolescents, which is defined as between the ages of 15 and 19, right? We found Barbados is here represented in Barbados is here represented in blue. So we can see that generally there's a downward trend, and this is comparing to the 1980s to up until the period of 2010 to 2015. We see that there are about 47 births per 1,000 girls between 15 and 19 in that time. So while it has decreased, it is not as low as our North American counterparts, and we'll talk about why that can be as time goes on. We also see then that in terms of a survey that was done among early adolescents, this is between 13 and 15 years old. This is the 2011 Global School Health Survey that was done by the WHO. So when they surveyed, red here is representing our females. About 23% of females had sexual intercourse in this age range versus 44%. So you can already see there's a big disparity just between boys and girls engaging in sexual intercourse. And we're among students who had ever had sexual intercourse, those that had sex for the first time before 14, for 56%. So we can see that about half of them would have been even younger than the age of 14. So we can use these numbers to see what the underlying issue that we have as it relates to sexual behavior. Now, recent trends have shown that, as I said, comparing the 80s to now, we do have a decrease in terms of the adolescent fertility rate, but there's still definitely more work to be done. I'm just going to talk about some factors which would have been identified from studies of various surveys. Again, in studies conducted by PAHO. So some of the risk factors that we have, you asked about why are we having earlier initiation of sex? So one of the biggest things that we have is one, just being male. So boys are significantly more likely than girls to report sexual activity, and they're also more likely to report multiple partners as well. Age as well being a factor. So of course, the older adolescents, again, in that words of 16 plus, also reporting increased sexual activity, and a history of things like sexual or physical abuse also increase that risk. You have things like psychosocial well-being and mental health of our youth as well. And this can include things like just underlying issues with rage, gang membership, if they've had things like carrying or even fighting with a weapon is shown to be correlated with increased risk of sexual activity for both boys and girls among these survey. Some other risk factors, again, I mentioned the peer pressure or the peer influence. So if you are within a group of friends and you perceive that your friends are sexually active and that you would be somehow made fun of if you were not, then you yourself will be increased risk. And boys have a higher peer pressure amongst them to be sexually active. Things like attitude to gender, how we perceive what is manly, what constitutes being a man in different cultures and society as well. So we have adolescent males who ascribe their manhood to also things like sexual prowess, etc. Other risk factors in terms of poverty, this was part of the study that was done. It was done all across the Caribbean. So things like, even being hungry in the past 30 days was also a correlated risk factor of having sex, early sexual intercourse. And then on top of that, not using a condom at last intercourse as well. Right? So we know that adolescents from lower socioeconomic status are more increased risk of having sex and then less likely to use condoms when they do. So we've heard a lot of things, and then there's what we call transactional sex. So transactional sex is, again, having sex in exchange for things. It may not necessarily be money if we're talking about like sex work or anything, but it's in terms, sometimes we find it in terms of exchange for even things as sad as it is, that we have a lot of people who are unable to afford school clothes or school items for children, and you find that transactional sex comes into play for even getting those things that we deem or we may not even think about, right? If you have a household that is already poor and you have somebody who you can rely on for lunch money and food and different things as well, that's where it comes into play. And finally, the last one is sexual orientation. So if you have persons who identify as either bisexual or homosexual attraction, that increases the risk factor for early intercourse, and again, no condoms as well. So these are all the risk factors, and they're applicable, very applicable to Barbados as well. But at the same time, we're talking about risk factors. We also want to talk about what are the protective factors as well. So we found then, the survey would have found then, or the study would have found then things like family connectedness is also a protective factor. So if you have the adolescents that actually felt connected to their families, were less likely to engage in early initiation of sex. So connectedness, talking about, do you think your family pays attention? Do you think they understand? Can you tell your parents or another family member about your problems? Right. So on the flip side of that, if you have, again, adolescents who would have run away from home, or who would have been a victim of family violence, or violence is the norm within the household as well, then that put them at increased risk of engaging in early sexual activity, and also then pregnancy as well for our female participants. And I think lastly, I think this is the last slide we have, school connectedness as well. So those who felt connected to their school are less likely to have sex. Again, do you get along with your teachers? Do you enjoy school? Those who, on the other hand, are truancy in terms of skipping school was also a risk factor. We have religion as well that, obviously the basis for, again, the discussion. So religious attendance or considering oneself to be a religious or spiritual person reduce the likelihood of sexual activity, along with your individual value system, right? So if you have values such as endorsing security and tradition, all again being protective against early initiation of sexual activity. So with all of that being said as well, while we have protective factors and risk factors, it doesn't mean that every adolescent that has these risk factors is going to engage in sexual activity. And as you said, even if they do, it doesn't mean all the time that we can have what we talk about, the dangers as it relates to sexual activity, which would include, of course, early pregnancy, the risk of sexually transmitted infections. When we talk about potential emotional and psychological side effects as well, right, of early sexual initiation.
Right, we're gonna come to that, but I want to tap into a few things you said, Dr. Gill. The mental health. Can you elaborate on that for me? The mental health of the persons who tend to be more at risk or likely to involve in early sexual conduct.
Okay, so when we talk about mental health in terms of persons who have underlying already have underlying psychological trauma, whether that be depression, whether that be anxiety, and that can stem from all the other things that we talked about. It can stem from your relationship within your family. Sometimes we tend to think that, how do I put it? We tend to look at everyone in a bubble in terms of only looking at people in terms of the environment that we see or that we've grown up with. But the unfortunate truth is that we have a lot of adolescents who are here that are growing up in some very, very difficult circumstances, are going through things that, even us as adults will never have to face or go through. We'll never have to know about things like abject poverty. We'll never have to know about really talking about things like transactional sex, which may seem like a very abstract concept, but for a lot of people, it is very real. It is very, very real. And these are things that you see in practice, and it can also depend on, you know, where you're practicing. As we mentioned before, I worked before with the Barbados Family Planning Association, where again we had have, although I'm no longer there, yes, the program still continues, where you have things like the Adolescent Young Mothers Program, which targets young women who would have already had gotten pregnant in their early teens. And what do you do from there? How do you continue in terms of breaking the cycle? And as part of the program, they have psychological support, because we realize that it's not only about the physical, okay, getting life skills and, you know, parenting skills, it's about the psychological. They have so much psychological issues that they have to unpack before you can even start to address the major issues. And it's very easy for us sometimes to look on the outside, and I don't want to say judge, but not even having a clue or understanding what they are going through or what they have seen from infancy to know that would have led them to where they are. So I think that that is critical to address things like family violence, you know, things, as I said, extreme poverty. For them, that is unfortunately the norm. So they don't know what the alternative is. They don't know what, when we talk about things like, even if we say, okay, we have in terms of teaching them about abstinence, that might not be a reality for them, because what they're seeing doesn't correlate with the message that they have in terms of their household as well. So they may be seeing multiple partners coming in and out of the home, you know, again, putting them at risk of sexual abuse. And most of them, you'll find that have undergone some form of abuse, whether that be sexual or emotional abuse as well themselves, and that puts them at further risk.
Yes, Dr. Gill. How about the fact, one of the studies that you shared showed that in Barbados and this part of the world, it seems like the number of pregnancies as a result of early sexual conduct seems to be on the decline. But can that be attributed to the increased maybe contraceptive use?
That can be definitely one of the factors as it relates to it as well. We also have, well, hopefully what is changing, an approach in terms of discussing sex among adolescents and sexual health among adolescents, as well as you said, decline. Now, one of the biggest myths that we have out there, really and truly, one of the biggest myths that we have is when we think in terms of educating our adolescents in terms of sexual health, sometimes we think that, well, if we educate them, that we're going to be somehow encouraging them. But numerous studies have shown that the more information we give our adolescents in terms of sexual health, it helps them to make better choices when faced with the situation on if they're going to have intercourse or not. Because, you know, that's one of the major things. I guess we will talk about that at some point,
Yes.
how we go forward.
But I'm glad you made that distinction. I'm very glad you brought that up. Finally, I'm just gonna push you at this point to tell me more about the gender socialization, how we socialize our men against how we socialize our young women.
Oh, wow. So again, we live in a society as well as mentioned that, you know, we have that association with what it means to be a man and what it means to be male. And sometimes that can come with, whether that be, again, societal factors, pushing that in terms of from a young age, young boys, we would have seen it in terms of social media trends and everything like that, pushing young boys in terms of sexual activity, again, applauding early initiation of sex among young men, shaming persons who opt to, in terms of delay on sexual activity as well. Even to the point where even if you choose to delay, a lot of people will lie about it as well to say, oh, you know, well, you know, because you that societal pressure. And as we saw in the research, the societal pressure is more for our young men in a lot of cases than our young women. And again, society is starting to, while we hypersexualize young women and girls, from a really, really early age, right? We we have continued to hypersexualize things. We continue when persons hit the age of puberty. Again, this mentality of, you've heard it all, oh, she ready and she ripe and all these different
After the lunch and the clothes and the outfits that are sold for these young girls.
Yeah, between the clothes and the outfits and yes, in terms of everything that we have and what we do in our society. They said where men are pushed to see that, again, the more sexual prowess I have, and that could then go on into early adulthood, where you see, again, multiple things like multiple children, and so is usually lauded as oh, you did good, you got 4 or 5 kids, so you know that everything is working as it's supposed to. So I think that we definitely have a lot of work to still be done. We've come a long way, but there's still definitely work to be done in how we address this stigma and this peer pressure among young people, and giving them the tools to be able to navigate that as well. And again, I think maybe that will come later on in the discussion on some of the things that we can go about doing in that regard.
Yes, thank you so much, Dr. Gill, for all of that insight. At this point, I want to bring in Dr. Courtney Yarbrough. And we have identified that there is an issue with the early sexuality and sexual conduct of our young people. But Dr. Yarbrough, what are the consequences of them getting into sexual activities so early? And in Barbados, is teenage pregnancy really such a big issue?
Hi, good evening. Thank you for inviting me to do this. This is something I love to do and to talk about and to teach others about. So I really appreciate that. And Dr. Gill, her presentation and my presentation will probably overlap quite a bit, as you can probably imagine. I was shaking my head quite a bit while she was speaking just now. I would like to share my screen to answer the question. So give me just 2 seconds. I've never done that before, so give me a minute. And then we will get started. Okay. Can everyone see that?
Yes, please.
Okay. So, okay, there you go. So let's just start with actually one of the same studies that Dr. Gill just mentioned. This is just a representation of the ages of sexual debut in our teens. And this chart actually goes all the way down to 10. I actually consider adolescents to start between the ages of 12 and 13. It can go up to age 25, actually. So that is the age group that I will be focusing on during this talk. This chart looks at both males and females and shows you how rapidly sexual debut, or first sexual intercourse, starts in our youth. And that same study that Dr. Gill just mentioned in 2011, the Barbados Global School-Based Student Health Survey, did show that our adolescents between the ages of 13 to 15, about 1/3 of them were sexually active here in Barbados per se. So that rapidly increases right afterwards. And because of that sexual debut, they have an increased risk of sexually transmitted infections, as you can imagine, and early teen pregnancy. This chart here, well, the sexually transmitted infections per se are caused by certain bacteria and viruses and parasites that are transmitted through unprotected sexual intercourse and through skin-to-skin genital contact, as well as through what we call primary transmission. That means from mother to child, and we'll talk about that a little bit later. But these are the sexually transmitted infections that are present in our world today. And here I have divided them into 2 categories. There are the curable ones, meaning that there is a medication that can completely eradicate the infection. So that would include the gonorrhea, chlamydia, syphilis, and trichomonas, and the others that you see here. But then you have the ones that are not curable, meaning there's not a medication that will completely eradicate it. And these infections are usually viruses. So the HIV virus, or the herpes simplex virus, and the HPV viruses are some of the ones that we see in our teens, as well as in our adult women and men, that are not curable, but can be manageable with the right treatment and medication. But why in particular is this so important in our teens? Well, as she said before, our teens are young, and a lot of them may have been coerced into sex, so they may not want to talk openly with their parents about that. Even if they were consensual with sexual intercourse, they may not want to talk to the parent, their doctor, or their nurses. And one thing about sexually transmitted infections is that it is the most common symptom of a sexually transmitted infection is no symptom at all. So they can carry this infection around for a long time without having any symptoms and pass it along to their other sexual partners. So, and even if they do tell their doctor or their nurse or their parent about being sexually active, they may not be able to get the recommended sexually transmitted infections for many reasons. Let's say they don't want to tell their parents, but their parents have insurance that will show an explanation of benefits and will show what tests they actually have. So they don't want to do that, or they don't have enough money to pay for the testing because it can be quite pricey as well. There's several tests as you see, several infections they should be tested for. Or let's say they do want to get tested, but their hours for school or their work or their jobs don't correlate well with the times for waiting for the test in the clinic or in the laboratories. And then a lot of our teens do have more than one sexual partner. So they may be, even though they get tested and get treated, they may get reinfected by their multiple sexual partners or even a new partner. And teens who have a history of a previous sexually transmitted infection actually have a higher risk of getting others. If, for example, teens who have HIV actually have an increased risk of getting other sexually transmitted infections. They're more prone to them. And their anatomy. Interestingly enough, our adolescent girls specifically, their anatomy actually makes them more prone to sexually transmitted infections. And this is what I mean by that. So if you look at the top picture, up here, you just see a picture of the uterine womb, just the body. You don't see the other organs around it. And this canal here is what we call the cervical canal. And this is lined by certain cells that in an adolescent actually comes out onto the surface of the cervix as well. And these cells, which are called columnar cells, actually are they adhere more to certain infections. Like they adhere more to the chlamydias and the HPV. So because of that, our teens are more prone to getting those infections if they're exposed to them. So their anatomy actually makes them more susceptible to those infections. Now, as we get older in our like mid-20s and our 30s, our cervixes looks like this, and that we have a less chance of getting the infection, even though we still can get the infection. So their anatomy makes them more susceptible. And our young people, because of not using condoms and because of the multiple sexual partners or being exposed. Yes.
Is it possible you can choose presentation view, maybe, or to enlarge your screen?
Oh,
because part of it is cutting off.
I'm seeing just the picture. So let's see.
Oh,
is that better?
Yes, this might be better. Yes.
Okay. Thank you. I didn't realize, like I said, that's the first time I'm screen sharing. I didn't realize. Okay. So in this chart here, this chart shows a range between ages 15 to 24, which again are the adolescent age range, and then compares the rate of STIs or new sexually transmitted infections in women who are 25 and older. And as you can see, our young women account for a substantial amount of infections: gonorrhea, chlamydia, HPV, herpes. But gonorrhea and chlamydia are the most common in that age range, but the other ones are very common as well. Now I wanted to particularly look at one particular infection, the HPV infection. It's human papillomavirus. That's what HPV stands for. And it is transmitted through intimate skin-to-skin contact, as I had mentioned before, but it can also be transmitted through sexual intercourse. It actually is the most common sexually transmitted infection in the world. Many people don't realize that is the most common one. And like I said before, a lot of times there's no symptoms whatsoever, so they don't even know they have it. HPV can be separated into two types, low risk and high risk. The low risk versions can cause genital warts or warts in the throat, called recurrent respiratory papillomatosis. And then the high risk types are the ones that causes the abnormal pap smears or the abnormal cells in different areas. And if untreated in some people, can lead to cancer. So HPV is a very important infection to consider. And this chart also shows the rate of HPV-associated infections to cancer. And if you can see at the bottom here, the highest number is actually in women in the cervical tissue. Like the other viruses that I mentioned before, there's no cure. There's no treatment available to cure HPV. It can only be managed by treatment and medication and procedures. But it can be prevented. And as in our teens, Dr. Gill already said that abstinence is not always a choice or a possibility, but that is one way to prevent acquiring the HPV. Another way is getting a mutual monogamous relationship or using latex condoms. And we do know that our teens don't always do that. But the last way is to get an HPV vaccine that will cover the 9 most common causes of this infection. Now, if that was the STIs, if you wanted to ask any questions about that before I go into pregnancy.
Just a quick question. The cancers in the mouth and the throat, I'm assuming
Yes.
we're getting that from oral sex?
Correct.
Okay.
Correct, that's correct. So any of that, any area that can be used sexually, so oral, vaginal, penile, as well as anal sex can acquire these infections, can cause cancer there for men and women, depending on what the organ is. Yes.
Okay.
Okay, keep going.
Yes, thank you.
All right. So like STIs being more prevalent in our adolescents, or very prevalent in our adolescents who are not taking or using condoms or contraception, so is teen pregnancy. As we have mentioned before, about the rate of sexual intercourse increases substantially as the teen gets older, and actually the rate of use of condom decreases substantially as the teen gets older, interestingly enough. So their risk of pregnancy is about 1 in 4 before the age of 20. And just like the research that Dr. Gill showed, this chart shows that the rate of adolescent fertility is between 40 and 50 per 1,000 in women ages 15 to 19 in Barbados. And Barbados is actually one of the highest in the world after certain countries in Africa, interestingly enough.
Wow.
So why is this? Why are adolescents or our teens getting pregnant? And Dr. Gill has already touched on many of these already. So cultural and societal norms, meaning, you have early introduction to sex through intergenerational relationships. And what I mean by that is young girls who are in relationships with men who are 10 years or older in age. There has been research, that same study that Dr. Gill mentioned also mentioned that in Barbados particularly, about 30% of our young girls between the ages of 15 and 19 have been in relationships with men who were 10 years or more older than they were. So that will increase their risk of pregnancy because they have less control over use of condoms and things like that. A lot of times too, they may not even know that they have the options of using a condom or other types of contraception, or they may have a barrier to getting the contraceptions. As I mentioned before, not having the money or the means or the insurance, or wanting their parents to know that they want the contraception and why they want it. But their teens too do have some misperceptions about contraception. One of the most common misperceptions that I hear almost every day when I see a teen in my office is that they're worried about gaining weight on the medication. So that's something that I have to talk to them about when talking about the different types of contraception and which ones have been proven to gain weight versus the ones that have not. And sometimes when they do have, excuse me. Oh, I'm sorry, that's somebody asked a question. And sometimes when they do use a contraception, they may not be using it appropriately, meaning they may miss the tablets if they're taking tablets, or if they have the patch may come off partly and they do not put it back on, or they take it off completely, not knowing when to restart the new patch. All of these things do increase their risk of getting pregnant. And then we also mentioned the sexual abuse and rape, as well as the income inequality and the low socioeconomic status, and the effect of being unhappy at home and at school with the increased risk of adolescent pregnancy. So I just wanted to take a few minutes to discuss what makes pregnancy in adolescents unique and different from pregnancies in adult women. Because there is a riskier, being a teen mother is actually considered a high risk pregnancy, interestingly enough, even if she's completely healthy, and there's no medical problems, it is considered a high risk pregnancy. And there are several reasons for that. So for some teens, they may have an inadequate familial support. Again, they are afraid to tell their mother or their parents that they are pregnant, or their significant other, the father of the baby, no longer supports them when they find out that they're pregnant. So they don't have the support to pay for prenatal care, so they get insufficient or sporadic prenatal care, which can lead to missing important testing and recommended immunizations, as well as missing, being undiagnosed for important conditions, such as gestational hypertension. Teens are actually at increased risk for gestational hypertension just from age alone. So you may miss that, and that can cause increased risk of adverse pregnancy outcomes for the mother as well as the child. The child can be small for gestational age, can be premature in delivery, and actually teens are about 2 times more risk of dying during childbirth than mothers who are over the age of 24. Teens tend to have an increased likelihood of a high-risk behavior, so they may drink alcohol or other substances, use other substances more often, or be in physical altercations as well. They are less likely to breastfeed, so that the newborn does not get that benefit of the breast milk. And as she mentioned before, there's an increased risk of mental illness in these teens, even before pregnancy, but actually during pregnancy as well. If they already have a history of depression and anxiety, that risk skyrockets after delivery for postpartum depression. These teens actually have a 7 times increased risk of suicide compared to older women. They have a higher risk of domestic violence, higher chance of repeat pregnancy in the near future, meaning that they will get pregnant before the age of 20 again. And then the consequences for the child in the future can be very poor as well, because of the mother's poor prenatal care, sporadic prenatal care, any of the medical conditions that were left untreated during her prenatal care, as well as the socioeconomic status that they may be in after delivery. And these children also are at a higher risk of teen pregnancy when they get older also.
Meaning the children of the teenage mother, when that goes up. Okay.
Correct.
I want to remind our listeners that you can place your questions in the chat on YouTube or in the Zoom. Please feel free to place your questions in the chat. You can go on, Dr. Yarborough.
Well, no, this was just a short overview of both topics, and I welcome any questions to discuss in more detail.
Okay, just a few things to elaborate on for me. The support during pregnancy, and how is this related to, how do you see this transpiring more or less when women are the subject of gangs, for example, they're members in gangs. I know a lot of women I would have come across when I was in obstetrics and gynae as an intern, who did not even know the names of their the persons who got them pregnant, or they knew those persons by some name or some call name. And you know, it is, as you say, a cycle to continue for that child now being brought up in that. How do you, in terms of having less support, do you see this playing out when the mother, when it is in a gang setting?
Definitely. I mean, they have less support from their biological family, obviously. And that may be the reason they're actually in the gang in the first place. They need that support from someone. That's how they got into the gang in the first place. That's a possibility when they're looking for a family. But being in a gang and being in that kind of environment, that's a high risk environment. So they have an increased risk of drug abuse during pregnancy. They have an increased risk of acquiring other sexually transmitted infections. They have an increased risk of poor pregnancy outcomes or sexual outcomes as well. So being in a gang is definitely by itself a risk factor for the pregnancies in these teens as well.
Okay, you touched on something else I wanted to ask about, a combination of at-risk behavior. When you see one, you see more. So those teenage pregnant mothers come in there involved in a gang, and then you also see drug abuse in there. A lot of our teenage mothers are smoking during the pregnancy, and no matter how much you counsel, they continue to do that, and then that starts to affect the baby, the unborn fetus. And then you mentioned about breastfeeding, they're less likely to breastfeed.
Correct. So that those, yeah, they're less likely to breastfeed. They have the high risk use of the smoking or the other drugs. They can affect the growth of the baby and the blood supply that gets to the baby. And so the baby itself can be small for gestational age. And if they're using other drugs like cocaine is actually a stimulant that can put them into preterm labor. So children born to women with that medication, or not medication, but with that drug can go into preterm labor. And that's a whole nother realm of issues for the baby, right? But let's say the baby is delivered full term in these patients and they're still smoking around the child. Even after delivery, the baby can develop other issues like asthma or respiratory conditions, or higher risk of other things like eczema or conditions that can affect their lives for the rest of their lives as well.
Yes, and we're saying that sexual activity too early sexual activity in the teenage life, in the adolescent years, this is a possible consequence of having developed a teenage pregnancy. And we're seeing that you quite well outline the dangers to the mother of being pregnant in your teenage years with your underdeveloped body. And is this still the case? You know, some women, some girls may have a large body habitus. We may call them big breed. Are they still at the same risk of having these complications, even though their body stature is larger than the average teen?
For sure, they're still at risk for an increased risk of gestational hypertension. They're increased risk for diabetes. They're at increased risk of actually having a child who's large for gestational age, which may make delivering the child difficult and may require a cesarean section with this possible complications. So yeah, poor diet too. Let's say her diet is poor in relation to her size. So her poor diet can affect her as well as the baby as well, baby's health. So all of that can be a risk factor for someone who's overweight also.
Indeed. And the last thing I want to challenge you with, Dr. Yarbrough, before I bring on the final panelists, what about the failure rate of the different contraceptive devices? My husband normally likes to say everything besides abstinence has a failure rate. And even that sometimes, because some women come and tell him, you know, they're not doing anything, but they're pregnant. So everything else seems to have a failure rate.
Yes, and he's actually very true. I always tell my patients too, the only thing that works 100% is not having sex. So that's very true. And so, you know, things that they have to remember to take, right? So tablets, changing the pack, anything they have to remember to take, there's an increased failure rate, right? So there's a perfect way. They're 98 to 99% effective if it's done perfectly without any mistakes, not forgetting to change the patch or take the pill when they're supposed to. Things that they don't have to remember to take. In the US, we have something called Nexplanon, a little rod that's inserted inside the arm. Here we have the IUD that lasts between 5 to 10 years. You don't have to remember to take that. It's there. It works beautifully. So those actually have a 99% efficacy rate because they don't have to remember to take them. So that is also an option in teens. I know some people don't realize that they can get IUDs, but they actually can. Okay. If they're actually active, yes.
Okay, and the thing is that we know teenage years is a time when they are highly unlikely to remember even to bathe on time, to brush their teeth, to do their homework. It's still a stage where they need a lot of parental guidance to remember the basic things. So so abstinence is the only one that they don't have to remember.
Exactly, that's easy.
Okay, I want to ask our final panelists. Thank you, Dr. Yarbrough. Sister Delvina Waite from the Child Care Board. Sister Waite, tell us, we've heard, I don't want to say the catastrophe, we've heard the situation. Tell us, what are we doing? What services are being offered by the Child Care Board to rescue our young people?
Okay, I want to say good night, everyone, and thank you so much for having me. You've heard quite a bit of really useful information tonight, so and a lot of what I don't want to go over. But at the Child Care Board, we know that the Child Care Board is the agency that's mandated with the care and protection of children at risk in Barbados. We know for the purposes of not only for data collection, but we know that child abuse is divided into five. Well, we have 5 categories of child abuse. We have our neglect, physical abuse, or we have abandonment, we have emotional abuse and sexual abuse. And I identified those because as we could appreciate that neglect, lack of supervision, and so on can lead to sexual abuse, physical abuse as well, abandonment, again, and emotional abuse. So all of these forms of abuse can, we can have sexual abuse coming out of these situations. The Child Care Board, we like to take both a proactive and an interventive approach to sexual abuse. And again, before I go there, let me just say that we know that in Barbados that the law of the land gives you permission to have sex at the age of 16. That's the law of the land, not the law of God. Yes, so sexual abuse technically is any sexual act between an adult, that's someone over the age of 16 and someone 16 years and under. And so that is determined as sexual abuse. And we also want to say here that sexual abuse is not just the physical sexual act, it's not just the penetrative act. It is, in addition to that, we have the fondling, showing a child new pictures, other form of sexual exposure, inappropriate words, inappropriate touches, what we call grooming, getting children ready, even young persons ready for to get to actual penetrative sex, etc. So all of these things are considered and categorized as forms of sexual abuse. Now, at the Child Care Board, as I said, we have taken both a proactive and an interventive approach to this whole sexual abuse question. We know that, well, one of the things that we do is that, and we do a lot of, is that we have a lot of parent and community education. We do a lot of talks, we do a lot of workshops, we do a lot of seminars. We have what we have in our primary schools, and we have been doing this here for many, many years, what we call the Good Touch, Bad Touch program. And this program is where we go into our primary schools and we target especially our class 4 children who will be leaving to go into secondary school. And we also, now we are targeting, in the last several years, we've been asked by teachers, principals, etc., to come and speak to our class 1 children and our class 2, class 2, class 3 children, even sometimes as early as infants B, because of the inappropriate sexual activity that we are seeing. Children are imitating what they see in their communities, in their homes, wherever, on television, whatever, in schools. And so we do this Good Touch, Bad Touch program where we teach children to protect themselves. We teach them about, what's a good touch, what's a bad touch, when a good touch can become a bad touch, like a hug. A hug is generally a good touch, but a hug can turn into a bad touch, depending on how it is done and the intent behind it. We teach them things like what are bribes and those types of things, so that they can learn, they learn about their body parts, what the correct terms for it, and generally we teach them that their bodies belong to them and their bodies and that they're important and worthwhile, and nobody has a right to touch them in a way that's going to make them feel uncomfortable. So these are the kind of things we would do in our primary schools. In our secondary schools as well, we also have, again, for the time we go in, we have like a one-day seminar or something in our secondary schools, and we also have some ongoing programs in there as well. During Child Month, we also do lots of work on child abuse. We might have seminars for various sectors of the society. It might be for parents. We've had boy talk, girl talk for adolescents, where we look at sexuality and other issues that affect them, and so on. So we try to take a proactive approach because we recognize that if you can prevent the problem to begin with, it helps everybody, especially in this instance as we're talking about our adolescents. We have heard tonight about so many factors, so many mitigating factors that can propel or maybe not propel, but encourage or tend to lend towards our adolescents getting into early sexual activity. And yes, the statistics are correct. Every month when we collect our stats, you would find that the ages between 50, the age, sorry, between 15 to 12 to 15, sorry, are generally the highest numbers, the highest number of reported cases, because that is the age where adolescents will start to experiment with sex, or that is the age where somebody, some young man, in most instances, sometimes it's a woman, might approach them or might try to, as they will come and tell us, you know, somebody interfere with me. So using the term that they would use. And so they would find that this would be the age that this age grade, this age range where adolescents would tend to come into contact or, you know, begin to experience some kind of sexual activity. And so we tend to like to do this proactive approach in as much as possible to educate, to give them the tools that they would need to keep themselves safe and to make wise and educated, informed decisions. Now, we also have our intervention approach. Now, first of all, the primary aim of the board is to ensure that a child is safe. So a matter is reported to the board. Now, I know we are talking about adolescent sexuality here, but I'm just going to talk generally about the interventive process as it relates to, and I'm using the category sexual abuse because we are talking about sexuality tonight. And so we want to make sure that the child is safe, especially if it's a young child. So we have sexual abuse cases for children as as young as, for any age group for that matter, babies, 2, 3-year-olds, whatever. And so the policy of the board is that children under the age of, reports made about children under the age of 5 are generally considered matters of emergency. And so an officer will get onto that immediately, and to make a determination as to, one, if, what are the, all the issues surrounding the particular report. If there is, as you go in there, you begin to make your assessment. Is the child safe? Is the alleged perpetrator, because at this time it's still an allegation, is the alleged perpetrator still is residing in the home? If the alleged perpetrator is residing in the home and will be in that home, then the onus will be on the child care officer to remove the child from the home. The child may be placed in residential care, but we try to do that as a last resort. Generally, what we try to do is to determine an alternative place of safety for that child, and that would usually be at a, another family member or somebody where this child can be safe. Remember, this is part of the interventive process. We haven't proven anything, but the primary goal here is to ensure that this child is safe. In some instances, based on the report and what is happening, if it's so blatant that something had happened there, and we might remove other children from the home as well, because if that one child is not safe, the others are not safe as well, right? So we just remove, especially their, other girl children who might be at risk, just remove everybody while the matter is being interviewed. And so moving on into that process as well, with the matters reported to the police, that is done immediately as well. That is done as soon as possible. The matter is reported to the police, and the child, in addition to that, immediately the child is sent for a medical examination. We have a doctor retained by the Child Care Board who does those examinations to determine if, things like the clitoris is in, sorry, the hymen is in, if there's trauma around the vaginal area, around the buttocks as well, because we know that we get reports of boys as well being sexually abused, and this whole homosexuality thing, etc. So that, in addition to that, that has to be determined. And let me just say here that there's some instances that collaboration is not always possible. It's not always possible to say that yes, a child was sexually abused. There might be just no evidence. It might just be something that the child said. Whatever it is, we know that it was sexual abuse or something was happening, but you can't prove it. There was no evidence to show. So sometimes you got to work with that as well, and we probably use other tools to determine whether whether what happened, or the extent that it happened. At every point we try to work with the parent. We try to work with parent. In most instances, it would be like with the mother, but we know that there are times that the parents themselves are not they don't cooperate. The mother would not cooperate. It might be her boyfriend, it might be her husband, it might be maybe even another child in the family. Let me just make a note here, because one of the issues that we're having, we've seen emerging in recent years is what we call sibling on sibling inappropriate sexual activity. So because of the toxicity of sexual activity in our society, we find lots on, not lots, we find a number of, we have a number of instances of cases where like adolescents, boys will sexually abuse their younger siblings, you know, siblings under 10, siblings or whatever age. So that in itself, because then as I said, we have two minors, so the boy is 15, but the girl is 8, you know, they're siblings. And those situations we also have to deal with as well. It might be cousins or whatever the case might be, right? So we try to work with the parents, and there's sometimes when parents would not want to cooperate, the mother, but the other parent would not want to cooperate for whatever reason. And sometimes the child not only have to be removed, but have to be made a ward of the state, a ward of the court, so that the intervention process can continue. And as I said, sometimes children from the same household, they have to be removed if they are considered at risk. There's counseling, there are a number of counseling sessions that would be given to that child. We use tools such as the anatomical dolls. I don't know who those who might be aware of these tools, these dolls, these lifelike, as it were, dolls that have all the body parts and so on. And we normally give them to the younger children just to play with. But if your child just given like a 3-year-old child the dolls to play with, and the 3-year-old, during the process of play, or at some point or immediately, you find the child puts put the female's doll's mouth on the male's doll's penis or something like that, which is not something the child would normally do. So you kind of know that the child have seen something, or is exposed to something. So we use the anatomical dolls. Sometimes we might use, depending on the age of the child, we might ask the child to write out what happened or draw a picture, right? So we try to use tools at times to get the information, especially if the child is really traumatized and the child is not, the information is not forthcoming. And having said that, I also want to say we work very closely with the police, and we try to, so that we can do sometimes at least one interview with the police, so that the child does not have to relive the situation over and over again. And so we would do that with the police, and it's not always possible. We try to do that so that we get all the information at one time, and the police can already begin to prepare their case for, if this matter has to come before the court. In addition to that, if we're looking at for adolescents who might become, well, even for those who are sexually active but not pregnant, never became pregnant, we have teenage workshops for these. We have self-awareness, and good decision-making workshops for these teenagers, where we just teach them, to value themselves, and, to teach them to make good decisions, how making, like I, we say to them, 30 seconds of sex, having sex can cause you a lifetime of issues, especially if you become pregnant. And even if you don't, you have to walk the road at some point in time. You might grow up, make it in life and, do well, but then you go around the corner, you see this young boy that at 14, 15, that, that know all about your body parts. You might be well married, and settled and everything, and you don't want that. So we try to give them the bigger picture and to show them that they're valued and valuable, and that they need to make decisions that would help them now and also work towards their emotional well-being going forward. We have parenting workshops for teenage parents. And I think there's also the Adolescent School does a yearly workshop for teenage parents as well. And we also would refer some of our teenagers that become known to the board to that workshop as well. And I know it's a very, very good workshop. And I know they also, for teenagers as well, they also get some counseling from the polyclinic as well. In addition to that, we have what we call the the hospital, the Queen Elizabeth Hospital has a scan clinic, which provides psychological and medical intervention for teenagers who are sexually active, so that they go on the ward and they're given a number of tests, make sure there's no HIV or any other sexually transmitted disease or whatever whatever, and then they're also given some counseling. So there's the working with the child care board and the scan clinic to try to to help them to get over this situation and as soon as possible and get on with their lives. We know that as it relates to legislation, that there's the Prevention of Cruelty to Children's Act, the Sexual Offences Act, and the Child Care Board Act, which all speaks to sexual abuse and of children and abuse of children generally. And hence we know that a child can only give permission under the laws to have sex at the age of 16. The question was asked, what was the alternative to victims facing a rapist in court? I mean, I guess this was in the context of a child is so traumatized, and we have had that. They're so traumatized that having to face the victim in court is just a whole set of trauma to them all over again. And unfortunately, in Barbados, we don't have what we know as, the pure in-camera hearings, not to my knowledge. But what we do know, what have experienced, is that the court is cleared and only persons involved in that case would be in the court. But unfortunately, that would also include the alleged perpetrator. And so that is one of the things that I guess we're still working on here in Barbados, but we don't have the real in-camera thing. But the counseling and preparing the child for court emotionally and so on is very important. And that is why it's important that we have cases relating to sexual abuse come up before the courts as soon as possible, so that the child don't have to, after they've settled down, and well, not settled down, but a long period of time passed and they're probably getting on with their lives, quote unquote, and so on and so forth. Then you get, a summons saying, well, the case comes out or whatever, and then you're just thrown into a tailspin all over again. You just, all the memories come up and all the emotional battles in your mind come up again. And so we want to try to avoid that.
Okay.
Yeah, so we just also want to, in conclusion, want to say that we also want to work with, we also work with the grandparents of the child, not the child, if the child, there's a baby involved, the child got pregnant, and we also work with issues dealing with the perpetrator, who might also be the father of the child, and if the man is the girl's boyfriend, her not wanting the matter to go before the court, and all those issues that are part of the equation as we work in that interventive process, that intervention process. Yeah. Mm-hmm.
Okay, thank you, Sister Wait. Indeed, that is a lot. I just wanted to clarify a few things. Are we saying that if parents, married or not, within a home, engage in any sexual activity in front of children, that is considered child abuse?
Certainly, that is considered child abuse as well.
Okay, just wanted to clear that up. And in the case of suspected child abuse, who do we call first, the police or the child care board?
The child care board. The child care board, you always call the child care board first. Teachers, whether it's in the church, wherever it is, child abuse is not an issue to be dealt with on at a church board, or whatever, because you don't want to have 10 more persons start knowing about this issue with this child. If it happens at church, if it happens at school, if it happens wherever it is, you call the child care board and you report it. Yeah.
Suspected if you can't prove it.
Well, even if you suspect it, yes.
Okay, and finally, before I come back to you, Justin, did you see any changes or any skyrocketing of cases as a result of the COVID-19 lockdown?
No, I made a check to, even before I came out of this program. No, it doesn't mean that there was, it might just be an issue of reporting, right? And many times that is the issue. I'm not reporting, but we didn't see a skyrocketing of cases, not as it relates to sexual abuse. Mm-hmm.
Sister Wade, Dr. Gill is asking if we can place a number for child care board in the chat that we can call if persons want to report any cases or suspected cases.
I can do that, certainly. The number, I'll put it here, but if for those of you, is 535-2800, 535-2800.
Thank you so much. Justin?
Thank you so much, Dr. Maxwell, for doing a wonderful job. You must stay with us, continue with us. You never know, we may hire you. What a wonderful job. So we want to thank all of our panelists so much. And we have some questions for them. So don't run anywhere. Quickly. Answer this as we go along. But I guess this is really for Pastor Miguel Denny first, and then we will go to the others. Does adolescent sexuality boil down to teenagers having sex? Are there any broader aspects to it, especially from a Christian point of view or Christian perspective? That second part is for Pastor Denny, but the first part, does adolescent sexuality boils down to teenagers having sex?
Okay, just confirming, it's a full question from me or just the second part?
Oh, the second part is for you. The first part is for the doctors.
All right, cool. I will give way to the physician.
Sure.
Well, good night again, everyone. So the first part of the question being if teenage sexuality is about teenagers having sex, am I correct in that?
Yes, please.
Okay. Well, on a whole, when we think about sexuality, it doesn't only involve the physical act of intercourse. And when we think about sexuality, we need to think about everything that is involved as a part of that. Now, again, when we think about sex, again, that can involve in terms of just the different types of intercourse, yes, that we have available when we talk about vaginal, oral intercourse, anal intercourse, etc., that we have that. But then we have to think about it from a psychological point of view as well, that's where sexuality in itself, as human beings, we are sexual beings as well. I know that we don't always think of ourselves as that, but we are sexual beings, and therefore it starts when we think about the lifespan of us as human beings and how we progress in terms of hormonal changes. So this is how we are made. We're made to have hormonal changes. So when we think about sexuality, we think about that change in the life cycle that occurs from the time we're young, and we go across for me, we go across the entire lifespan, and we think about the changes that can occur at puberty, the changes that occurs in the way how we think and the way how we approach sex, and all those things, hormonal changes, hormonal changes, body changes, all of that plays a role as it relates. So when we talk about sexuality, like we can't only think about it in the silo of teenagers having physical intercourse. No, we have to address all of them, the changes and feelings that come about as it relates to sex and newfound feelings and how do we manage and how do we cope with those, because teenagers have a lot of questions in terms of, I am having all these new feelings at puberty and I don't know what they are, neither do I know how to deal with them. And if they aren't given the appropriate information on what is happening and the change that's happening, again, similarly, they may act on emotions without really fully exploring what those are and what it means. And then we also have to be careful on how we talk to adolescents about sex, because we don't also want to have persons with a lifelong approach to sex, because we think about it in terms of okay, this is the position, sex before marriage, or it's wrong. But then what happens as we continue on in terms of the life cycle? When do we say that change occurs? If we've talked to teenagers about sex and we've made it this, for a lot of people, dark, scary topic, when do we transition? When they become, later on in adulthood, the change to, okay, well, no, it's not too bad and scary and horrible anymore. But we don't realize that how we start the conversation, it has a long-term effect on us going into adulthood as well. Mm-hmm. So that's just my point of view as it relates to that. I'll just give way to Dr. Maribro.
Can you just repeat the questions so I can understand?
Sure. I can repeat the question. does adolescent sexuality boils down to teenagers having sex?
Okay,
And
so
does sexuality equals sexual activity?
right, I understand. Okay, so I agree with Dr. Gill. I mean, sexuality, the word itself has a wide definition. So no, it's not just sexual intercourse. There are other factors involved, more emotional and then physical as well. So I agree with Dr. Gill. She pretty much explained it very well.
Yes, thank you very much. And we're gonna, before Pastor Denny comes, we're gonna ask our guests to post the questions in the chat, please. And we are going to ask, I'm going to ask the questions. So we're gonna ask all persons to ask their questions in the chat, and I will ask the questions. Thank you. Pastor Denny, from a church's point of view.
Well, the church's point of view is one of a spiritual and also practical background, in that what was highlighted by the physicians is applicable to us as a church. You could match it due to stigma, due to not being properly taught about sex while growing up, and we can only pass on what we've been taught or how we've viewed sex. So sex, for many individuals, even in a church setting, is either taboo to talk to adolescents or young adults with. And I'm not just speaking in terms of a church perspective, I'm even speaking from a family perspective. Parents might be reluctant to teach sex to their children. And so if all your child gets in terms of the knowledge of sexual activity is from what a school teacher may provide, and if that's in a public setting, it may not carry that Christian context that we're looking at, as well. If the training is only given in sporadic moments and not a well-structured, well-timed out discussion. And you'll forgive me if my emphasis is a lot on parents, but as a Seventh-day Adventist church, we believe in the partnership between home, school, and church. And the church can do so much, and I believe the church does a lot. In both Adventure and Pathfinder ministry, we have aspects that cover sexuality in a broad sense. But if a parent isn't willing to sit down with their child and be open yet candid, have that balance in terms of how can I expose my child to sex in such a way that it is something they can look forward to at marriage, and not just something that they must shy away and look at behind closed doors, or run away and go and do so that no one notices and the church won't disfellowship them because they haven't found out. If church, home, school, by extension, works together to help expose our children to what sex ought to be and not just what the media shows, then we will make better headway. Of course, all of this within the context of Christ working in us and helping us to appreciate sex as it ought to be, and not just a case where coitus takes place. It's more intimate, it's more it carries more than just physical intimacy. And so as a church, with what we believe, I think what we as members and church leaders will have to do, one of the things we can do on a local level, we can provide at a conference level, but at a local level, where there's more interaction, more intimacy, we can create forums like these, and I must commend you on this kind of forum, that persons from your district in a closed yet open atmosphere can discuss freely and get a greater glimpse of sexual intimacy amongst adolescents and beyond. So I must commend you for this type of initiative.
Thank you. And from the producer's end, time is against us now, so we're gonna ask all of our lovely panelists just make the answers a bit short for us, so that all of the persons who are asking questions can get their questions answered. Here's what we're gonna do. Here's the next question. There's been a big debate in the US about giving the HPV vaccine to girls under the age of consent, the 18 years in the US. And what are the issues with that in Barbados, where the age of consent is 16?
So can you repeat that?
Sure. So there's been a big debate in the US about giving the HPV vaccine to girls on the age of 18. You know, on the age of consent in the United States, which will be the age of 18. And here in Barbados, where the age of consent is 16. So So what is the issues about the HPV vaccine given to on the age young ladies or adolescents in this case?
Okay, so you're not asking me without the parental consent. You're just saying in general what the ages are. So the recommended age for HPV vaccination is actually between the ages of 11 and 12. It can actually be given as early as age 9, and the purpose of that between the ages of 9 and 12 is to give the HPV vaccine prior to their exposure or their first exposure or first sexual activity. So that's why that age was actually chosen, and that is the age that is actually recommended here also in Barbados. So usually right after the 11 plus, they can go to the polyclinics and get their vaccinations. The HPV vaccine is one of the ones that they can get at the same time.
Okay, and this is a follow on to this one. It says, is the HPV vaccine mandatory now for 11-year-olds going to secondary school? Is it mandatory here in Barbados?
No, my understanding is that it's not mandatory. It's still a choice that a parent can choose to.
Okay, noted. Thank you very much. All right, let's go on to the next question. It says, what is the importance of young men abstaining from sexual intercourse? What is the importance of young men abstaining from sexual intercourse?
Okay, maybe I'll start off with that one. I mean, I'm trying to keep it, I'm not sure what perspective that they mean, but in terms of when we talk about young people in general, I wouldn't isolate it only to young men, but we do see in terms of what I spoke about one of the risk factors as it relates to early onset of sexual activity that young men are twice as likely than young women to be sexually active from an earlier age as well. And we have to, again, dig a little bit deeper to find out the reasons behind that. And again, when we talk about sexual activity, the focus is usually a lot on young women and young girls because the visible repercussions as it relates to pregnancy are usually the burden is carried by the female. However, we know that that's not the case. It obviously takes two people, and we still have things like SDAs. And if they get someone pregnant, it's still also their responsibility as well. So I would say from the point of view of, any young person having sex without fully understanding the consequences are using the adequate protections to protect themselves against sexually transmitted infections, pregnancies, and of course, being emotionally ready to engage in that as well. I would definitely say we can more education, and again, how we as a society view and pressure young men from that point of view. I don't know if that would suffice.
Yes, that was good for us. All right, quickly, Pastor Denny, this one is your question. Seeing that as we look around, the number of young people having sex in the church is increasing, what programs are you looking to implement that can help young people?
Well, I'm very careful when I hear statistics like those that say we have more young persons having sex. Makes me wonder how these statistics are being collected. Unless there's an actual question or something to that effect. What I would say is, I think while we can plan as a conference to hold activities, and I know the Women's Ministries Department has done a lot in that area. I think last year there was a program on restoring your purity, speaking about sexual purity and virginity and whatnot. I think what we can do as well as host programs, but empower churches to host programs like these for their youth, whether through their AY societies or as an entire, or not as an entire church, but have youth and adults be able to speak candidly, openly and freely about the topic of sex, and try as best as possible to remove any stigmas or taboos that can be associated with it. That would be my initial recommendation or advice right now. Not that at a conference level we can't plan, but that level of intimacy that comes at a church or even a district level where persons can meet and discuss like what we're doing this evening creates that level of intimacy and a level of freedom where no one feels too uncomfortable about the topic and persons can get their questions answered.
Great. And this is to you too, Pastor Denny, and also Dr. Maxwell. As it relates to the HPV vaccine, members of the churches, they're asking, can the church members give their children, well, their young ladies, their daughters, this vaccine as well?
That's a very personal decision. I don't believe the church will ever mandate something like that to do or not to do. That's a very personal decision for that child and that parent to decide. And Dr. Yarborough is quite specialized and trained in that area. I respect her expertise and her experience in that area with regard to the age of the vaccine, the benefits of the vaccine. And we must acknowledge that, especially in the department where I work, the cancer treatment department, I do have young people with cervical cancer from the human papillomavirus. The HPV vaccine would also prevent the infection then going on to cause the cancer. So it's something that I would say again, the church cannot mandate not to give. And as Dr. Gill made the point earlier, that quite often we believe that when we're giving sex education, we're telling children to have sex. They're not one and the same. Same thing with discussing the HPV vaccine. We're not saying this is licensed to go and have promiscuous sex before you're married or anything, but we need to have the conversation, and they need to have the conversation in the church from reliable sources and be informed to make good decisions. As Dr. Gill said, it has been proven when children are given correct information, they make wise decisions in the position.
Okay, no, Dr. Yarborough, you want to add to that, or that is fine with you?
Well, it's definitely a personal choice. It's a personal choice between the families, the mother and the child also. So that's why it's not mandated yet anywhere that I know of. Maybe, I think Australia is the only country that has mandated it. And that there's been research that shows that those kids who've gotten it without even a question, they don't even, it's like a part of their general vaccinations. They've gotten it, and research has shown over 20 years that their HPV infection rates and the cervical cancers and all those things are dramatically lower. So it's not mandated, but it's still a personal decision, but I'm definitely a proponent for it. So if anyone has any questions about it, I'm more than happy to answer them for it.
Okay, great. And I know there are a lot of questions coming in, but ladies and gentlemen, you know, I just want to make sure that we get these questions answered. I know you have them, but I'm going to try to balance them with the producers, so just bear with me. This one is saying, Pastor Denny, I know I mentioned you just now. Are you fine with what Dr. Maxwell just articulated?
Yes, it boils down to one's personal choice, and taking a vaccine doesn't necessarily mean that you are intending to have sex before marriage or whatever the case is. And any marriage counselor will tell you, even before you get married, even if both of you have been attending the same church and have been at least faithful as best as possible, to still get a full body work, get yourself tested for all manner of illnesses, so you know what you're getting into in marriage. And you could contract something that was not sexually transmitted, at least by you, not that you got it from having sex, but just to be safe. And so for that, I will leave it as a personal choice. But taking a vaccine does not necessitate that, okay, I take the vaccine, so I am free to have sex and be free from cervical cancer or any other virus, HPV or otherwise.
Okay, great. This question is asked here. Is it safer to teach my 14-year-old to use a pocket rocket rather than seek a sexual partner? And this is, I guess, to the doctors here. Is it safer to teach my 14-year-old how to use a pocket rocket rather than to seek a sexual partner?
I'm gonna actually have to ask, what is a pocket rocket? I have no idea.
Well, I was hoping that you guys knew what that was. I am totally, I must admit, as Sister Wave, you want to chime in here? You know what is a pocket rocket? I know your mic is on. You're muted.
I think I have an idea.
Sorry, I don't know what it is. Sorry.
Okay,
Yeah.
go ahead. Oh, go ahead, Dr. Gill.
Well, I don't want to assume, so I don't know if maybe the person is still there, but from my understanding of what they may mean, I'm not sure.
Sex toy. It's a sex toy. I didn't want to assume.
So.
I didn't want to assume either.
I didn't want to assume, so I
Right.
didn't think as well. Again, that is again a very personal choice. That's not something from a medical point of view. I don't know if, you know, to really give an answer about that, because it all goes down to what your views are as it relates to your personal views, as it relates to things like masturbation as well, which in of itself is a big discussion that, you know, when you talk about you know, your views or the views of the church, then I really can't comment on that. I mean, in terms of, if we're talking about it from a purely point of view, from a medical point of view, which is where, you know, if you don't have a sexual partner, then you decrease your risk. Ultimately, if you're not having penetrative intercourse, you're decreasing your risk of contracting pregnancy or SDAs or anything else. So from that point of view, when in some cases, when we talk about different types of intercourse, we talk about that as well, because, you know, again, putting all of the options out there, but again, that's, I think, very personal, and that would come down to what your own personal belief system is. So I don't know if anyone else wants to take over from that. That was a tough one, I will admit. That was a tough one to try to answer.
Okay.
I actually Googled it. It is a vibrator. I just Googled it. It's a vibrator. And again, I agree with Dr. Gill. It is a personal choice. I would like to add, though, that if you are, I don't know how you can teach your child how to use that. That's kind of interesting. But you also need to teach them how to clean it, because it needs to be cleaned properly to decrease the risk of other infections as well. So that's an important point as well, and keep it clean with soap and water.
And what I'd also like to add, if we're going there as well, not only in terms of cleaning, but also in terms of, usually that comes with other connotation in terms of how to, when we talk about using these things accurately as well, because they, again, depending on the age of the child, you have an increased risk of, you know, as you said, when we talk about teaching them, you know, overuse and talking about potential dangers. And then we have to add, the other issue that comes up is, what is the underlying, usually, again, when we talk about uses of things like sex toys, etc., it can come in the connotation of things like pornography. And so that also gets involved. So you also have to have, that's a slippery slope when we talk about how do you, it's not just about teaching them to use it, it's about teaching them to, about all the other things that can come as part of it. So that's why it's just not an easy yes or no answer, because that usually goes down a whole different trajectory.
Okay, thank you.
If I may just add a little snippet to leave something spiritual in the midst.
Okay, I was going there. Go ahead.
All right, no worries. Again, as the doctors rightly said, is about your beliefs and standards, your views on sex and whatnot. I think as if we're looking at the ideal being sex or the holiness of matrimony, then simply trying to use a sex toy, a vibrator, to satisfy one's desires now, in the hopes that they will not eventually have sex with someone else. That's still a big risk. That's still, in my mind, that's very iffy. That it can lead to something else. You may be protecting from one aspect, but not dealing with another issue, which would really be about self-control and managing your feelings and how you respond to them. So a greater discussion has to be held, rather than just saying, okay, you use this instead of going to the boy behind the road or going by the next door neighbor. The conversation has to go beyond just using a sex toy versus getting pregnant or catching an STI. For the Christian, it has to go beyond that.
Great, great. Thank you for putting it in perspective, Pastor Denny. Now, I know, ladies and gentlemen, we have a lot of questions. Now, what we're going to do is that I'm going to compile these questions. I'm going to give them to Dr. Maxwell, and she's going to liaise with all of the professionals here and get the answers, and they're going to get them back over to you. I know who you are, so don't worry about them. If not, we'll be here, you know, for a longer period. So Dr. Maxwell, I'm going to give you time to give you the closing remarks now, and then I will then do my wrap up. Over to you, Dr. Maxwell.
Thank you, Justin. I really want to thank all of our panelists this evening. Indeed, we know they do a hard job every day, and it was gut-wrenching while they were speaking, especially Sister Waite, you know, recounting some of the incidents, especially with the children under 5 years old and so on. Being a mother of 2 girls, 10 and 4 years old, you can imagine how this was for me. It doesn't matter that I'm a doctor, it's a very serious issue. I'm glad we have started the conversation. I pray that, Justin, this is not the end of the conversation. Again, I really want to thank our panelists, and I invite them right now. I want to let them know that an invitation will be coming again for us to even go further into these discussions, whether in different districts of the Seventh-day Adventist Church in Barbados, maybe in local churches and youth groups. But I really want to thank them for the wonderful job that they would have done tonight, and the research as well that they would have had to do. I really thank our youth director, Pastor Miguel Denny. I know our young people in the Seventh-day Adventist Church throughout the East Caribbean Conference look up to him and respect him. And I'm very thankful he was able to come on this program with us tonight and encourage those young people to come as well. So thank you to all of our panelists. Justin, thank you for inviting me to be here as well and to work along with these wonderful people.
Yes, on behalf of Pastor Bernard Prescott, on behalf of the St. Thomas District of Seventh-day Adventist, we also want to take this time to thank all of our panelists. You are the host tonight, Dr. Maxwell. And I just want to let the district know that Dr. Maxwell is our #1 supporter, you know, outside of all the members who come weekly. But Dr. Maxwell is really our #1 supporter, you know, and we really want to thank God for her, for putting on this program. She's the person who, you know, we liaised, we did all the work, but she's the person who got all of the panelists, everyone here. She got a great idea by Dr. Maxwell. So thank God for you, Dr. Maxwell. And I just want to thank all the persons. So again, our sponsors, for persons, all our teenagers, all of our adolescents. We just want to let you know, we're going to ask my producers to put up the sponsor slide. We are sponsored tonight by Nikki's Sewing and all of the stuff right here. So we just want to let you know that if you need your face mask to go back to church and you need your brooch to match, you know, the ladies, you know how the ladies like to do it, they like to match, they like to dress well. So you get all of your face masks, all gentlemen as well. Now, I don't know if you can see this well, but I also have a face mask made by Nikki as well. So we want you to know that Nicola made all these face masks and all of this stuff as well. So if you're a gentleman, if you're a lady, you can get your face mask as well. And if you're returning to primary school or maybe secondary school, you can get your uniforms made by Nicola. 249-3965 and 420-2543. That's the number to contact Sister Nicola to get all of your sewing done. And also the Publishing Department of the East Caribbean Conference, 429-7234, and you can get these books. Now, you've listened to the program. These are excellent books, and you must have these books. Now, knowledge is power. Ladies and gentlemen, you must have these books in your library. Now, if you realize quickly, as I wrap up, if you look at television now, especially on Zoom, all of the persons will, and you look in the background, all of the persons are showing off their lovely libraries. And these books are books that add to your library. So I'm saying to you parents, to get to adolescents and parents, you need to buy this book. For all your teens, you need to buy the Complete Tween, by Nelsie Van Pelt. Excellent author. So these books are rightly priced for you, and you can call the conference office 429-7234, the East Caribbean Conference of Seventh-day Adventists, to get these books. So on behalf of the St. Thomas District, of Seventh-day Adventists, we just want to thank you for joining us. So let us close with prayer. Father God, we thank you for a wonderful program. We hope that this program will not be a one-off. We will do it for AY. We will do it with a joint program with the Maranatha Church. We will do it again and again. And we thank all of the doctors who came and they give of their time. Sister Leah for giving of her time. And Dr. Maxwell, Pastor Miguel Denny for doing his lovely work as the youth director. We just want to bless all of them. Bless all of them, please. Guide and direct this program and all the other programs to come. And have us have a wonderful night. In Jesus' name, amen.
Amen. Amen.
Thank you for joining us, ladies and gentlemen.
And thank you for having me. It was
All right. Thank you.
Thank you so much. Bye-bye.
Thank you.
very
Bye,
much.
everyone.
Good night, everybody.
Well, Dr. Maxwell, we have to get the questions copied to you so that we can share them with all of the presenters.
Yes, please.
Right. So let us take them from Zoom here, and we promise them, so we have to do that.
Sure, no problem. As soon as you get it to me, I'll get them to
Sure.